Now, tomorrow is a World Oral Health Day, a day intended to improve access to dental health care information. So today we do host the Assistant Commissioner Oral Health at the Ministry of Health, Dr. Juliet Nabbanja. A very good afternoon, and thank you for joining us today.
Thank you too. Good afternoon to you, Sandra.
Well, usually when you're in different conversations, sometimes someone is speaking and you wish they can stop because what is coming on the other end is not that pleasant. Would you say that is unhealthy teeth, or someone is having an oral problem? Is it usually that? It
is definitely an oral problem, an oral health problem. And I think statistics in Uganda put it at 37%. So that's huge. And if it's your friend and you say you don't want to get close, the friendship is going to die off. So mainly we look at the gums to be the biggest culprit for bad breath, because if you don't brush and the food impacts in between your teeth or under the gums, then it rots, if I can use that word. Slowly it builds up bad breath. But a rotten tooth also can bring out bad breath. And this really depends on the bleeding, because the tooth has blood vessels in the inner part of it. So when the decay gets into that part, it causes bleeding. And it's really around the bleeding that the bad breath starts. Well, dental health care in this country is quite expensive. Would you say it is as a result of people going too late to get medical attention? Because a number of people always say dental health or getting medication when it comes to dental issues is quite costly. That's true, but we have looked at the other side of the coin. Where is the cost coming from? Because if you go early, I can assure you the cost will cut 3-4 times. Because when you go early, the condition, if it is just beginning, it is intercepted, you need less intervention. But if you go late, the interventions increase. And dentistry is high equipment service. So that alone can contribute to the cost. It may not be the procedure they are doing at that time that increases the cost, but it is the equipment that goes into that, and all of that surrounds the materials and all of that. If you went early enough and you needed a simple filling, it will take the dentist maybe that drilling machine and just the filling material. But as you advance into other procedures, whatever is input is also expensive. Would you say there is a missing gap, that there's an information gap? Because if you're saying the majority of us, and I can also speak for myself, usually we go to the dentist when it's a bit late. Do you think there's a missing gap somewhere? A big gap, Sandra, very big. How do we fill that gap? We celebrate days like this, increase awareness, come out when we have an opportunity to share with the public and talk to them that, look here, going for dental health doesn't have to wait for pain. True. You can go for that checkup, and it is recommended twice a year. When you go without pain, you are unlikely to lose a tooth, and you are very likely to spend very little. But when you go too late, the dentist may have to build your tooth 2-3 levels, and all that is dental material, which are expensive on the market. It's not only Uganda. So World Oral Health Day tomorrow, what are some of the activities that we should look forward to seeing? The day is globally marked tomorrow, 20th, but we have pushed it to Monday to accommodate, like people who won't be able to leave home on Sunday. So the Ugandan celebrations are actually on Monday, but the global day is 20th. We have dental camps that run through the week. We have a camp starting on Monday. We are working in conjunction with the Uganda Dental Association. So Monday will be pitch camp at Mulago Dental School, Mulago Dental School Gardens. We expect to treat 500. That's our target. If we hit it, that will be celebration. And then we hope to give them... free? For free. Okay. We hope to give them toothbrushes sponsored by Nice House of Plastic and toothpaste. So when we are doing that, we know that we may not finish those numbers that we target. So we push it throughout the week. And Uganda Dental Association will continue to also Buganda Road on Tuesday. They will continue to the handicapped home in Mengo, the home of the handicapped, and then climax on Saturday at Makerere University Dental School. The one on Monday is Mulago Dental School. Then Saturday is Makerere University Dental School.
So people can come through if they have any
throughout
issues.
the week here.
All right. Thank you so much, Dr. Juliet Nabbanja, who is the Assistant Commissioner Oral Health at the Ministry of Health, speaking to us ahead of World Oral Health Day that is happening tomorrow, but will also cut across in the coming week. Thank you as well for joining us.